In this next video, I'm going to show you how to correct what is termed a left-on-left sacral torsion, and I'm going to correct it using what they call a SIMS maneuver or SIMS technique. So the idea would be that you'd palpate the PSIS, and then if you roll into the sacral sulcus, the right side would be deeper, indicating that the right side or the sacral base would have gone into nutation, and it cannot come back on itself into a counter-nutated position. And typically the lumbar will be more increased in terms of its lordosis because the sacrum will be in nutation. So to place a patient into the SIMS position, we've already done like a rehearsal so the patient knows what it is I'm trying to achieve, because patients don't understand what it is you want them to do. Okay, so I'm going to bend both their knees, and then from here I'm going to control the position of the hip and roll her into this position. Okay, so this will be known when I get there into the SIMS. Okay, so I'm going to bring her knees onto my hip so I'm not physically taking too much of her weight. Now what we can do from here is palpate the L5S1, and we can do that by going into flexion. Make sure I'm on the spine, there we go. So I can feel for the motion. Okay, so the idea is that I want to flex the spine because that will induce, flexion of the spine will induce counter-nutation of the sacrum. I can also add in left rotation of the lumbar as well, because that will encourage the sacrum to rotate to the right. Now, from this position, I'm going to change hands and feel the PSIS and roll into the sacral sulcus. And I'm going to slowly bring the legs down because this induces a side bending, like an opening on that right side, allowing the sacrum to come back. And then what we're going to use is, if you push your legs up, so she's going to use the piriformis on the top right leg here for 10 seconds, like a MET, a muscle energy technique. And after 10 seconds, breathe in please. So I'm going to palpate the space in the sulci, and then I'm going to slowly use the piriformis to encourage, because it attaches from S2 to S4, the anterior surface, encourage you to pull, if you like, the sacrum back to the neutral position. And then once again, please. So you can do this 2 or 3 times. It's all about the awareness of what you feel from the fingertips here. And then after the, let's say, 3rd time, I will then hold the position for about 25 to 30 seconds, hopefully maintaining the new position. Be careful with this one. If you've got someone who's younger, it should be okay. But if you've got hip pathology, say of the right leg, because it's externally rotating, but the left leg internally rotating, you might find it might cause some irritation here. So just be a bit aware of the patients it might irritate, okay? Once I've done, I bring my patient back into the neutral position in here. Okay, my couch is moving. Come on to the PSIS and roll over, and hopefully the sacral sulcus will now be symmetrical.